This segment is brought to you by Busamed Muderfontein Private Hospital.
Dr. Mboyi, thank you for joining us on Living Your Best Life.
Thanks for inviting me.
Thank you. So today we're going to talk about prostate cancer, but I would like you to enlighten our viewers about what is a prostate and what is its function.
Well, thanks for that question because it's a topic that I'm very passionate about. Prostate is a gland, a walnut-sized gland. It's firm, it's sitting between your bladder and the penis. So its function basically is to secrete the fluid that is used by the sperms as what you can call your ejaculum or your seminal fluids.
How does one test for prostate cancer?
When it's males, especially above 50, then a PSA test is done and then it gets picked up. Then the doctor will do what we call a digital rectal examination, where you sort of feel the prostate itself, if it's nodular, if it's got irregularities in it, and then we know that there is something wrong with that prostate. And then if your PSA is high and the doctor has felt some abnormalities on the digital rectal examination, then it goes on to doing a biopsy and then confirming whether there's cancer or not.
I'm Ronin Kabinde. I'm a prostate cancer survivor. In June 2016, I was diagnosed. I'd gone for a routine checkup, and after all the blood tests were done, I received a call from my GP telling me that I need to go and do further tests because my PSA is a bit elevated. Fortunately, my cancer was detected at an early stage. In July, I started my treatment, and after 3 months, I did radiation, and thereafter, I have not been on treatment at all. And my PSA result has always been 0 since. And as a result of that, I got inspired to start support groups. I'm a director of Can Survive Support. It's an organization that deals strictly with support groups. It helps people go through the long, lonely cancer journey, and I can be contacted at 078-692-4839. And those who want to join the Busamed support group, they can call reception at Busamed and ask to speak to Lindigo.
Should a male be having regular prostate checkups? And at what age should it start?
Screening should be done. That's my opinion. But studies would say to you, the randomized trials that have been done all over the world, there is a very minimal benefit to screening. And they are actually against doing your PSAs routinely, like once a year on the patients. But from the results that we've had is that most of the patients that we're treating at this point is patients that have come for routine PSA, and we pick up that it's high. And in most of them, when the biopsy is done, there is prostate cancer. And sometimes it's not even your very low risk, it's your more intermediate risk ones, which actually need treatment. The recommendation is, if you are okay, there's lots of things involved, especially the family history when you screen. Family history involved because you are at higher risk if there's family history. And if you add more and more relatives, then the higher the risk of that. Then we say you must start screening at around 40 to 45 years of age. And then we continue your screening as you go along. But traditionally, it starts from 50 years onwards.
Dr. Mboyi is a professional doctor. She listens to you as a patient, and she explains to you thoroughly what kind of treatment she'll give you and how also the treatment will affect you. You know, in most cases, people just tell you that you've got cancer, so we'll give you chemo or radiation without explaining how it will affect your life. At least Dr. Mboyi is able to explain all that to you.
What are some of the treatments available now for somebody suffering with prostate cancer?
We've got multiple options. That's why I love the cancer, because you've got multiple options, and they can actually cure the patient in terms of your survival rate reaching 100%. Depending, when we talk about prostate cancer, there's two things. We stage it. When we stage it, as I said to you, you do your examination, you do your biopsy, and then you do the scans if needed, if it's been proven that it's cancer. Your MRI scan will show you if there's any extension outside the prostate area or even in the capsule of the prostate. And then if your PSAs are very high, we do what we call a bone scan, and then it shows if it hasn't actually spread outside, which is what we call metastasis. Then we go to what we call risk stratification. So we've got your very low risk, intermediate risk, and high risk. Now, when it's very low risk, there's options. The option that I'm going to add first is active surveillance, which some people now are very fond of it. And then there's surgery, whether you do the robotic one or your traditional prostatectomy. And then there is radiation therapy, which is in the form of brachytherapy or external beam radiation therapy.
Can prostate cancer be prevented?
The answer is no.
So in terms of somebody that does have prostate cancer, what advice can you give that person to maintain a good quality of living?
After the treatment, yes, the critical thing is to stay healthy. As I said to you, exercise, diet, those are the two most important things, and comply with checkups. We need them to come for follow-ups because we usually follow them up with your PSAs and sometimes after a year with scans. So keep everything in check until we tell you you are fine.
Perfect. Thank you so much for joining us today on Living Your Best Life.
Thank you so much.
Busamed Modderfontein Private Hospital offers more than exceptional clinical care by bringing our company values of accountability, friendliness, respect, integrity, and quality care to life. Busamed Modderfontein Private Hospital offers their patients and their visitors the ultimate Busamed experience, premium care, personal touch.